Can you talk to me about yourself?
Sure. So my name's Debbie Ravert. I'm an emergency physician in Baltimore, Maryland, and I was at a conference today and met a friend who asked me to share the following story. So I used to work at a different healthcare system that had a small rural hospital, which was owned and run by a nonprofit, but this was a community hospital. And that hospital provided basic essential services, emergency services, OB-GYN, and it was a very poor community with a lot of Medicaid patients. And after that nonprofit took over the community hospital due to a bunch of financial pressures, they ultimately ended up closing the mother-baby unit. And that was devastating for the community because a lot of the mothers in that community were very low resourced, didn't have access to transportation, and the nearest mother-baby unit that accepted their state's Medicaid was over half an hour away by car. So you can imagine someone might go into precipitous labor, not have easy access to a car, and deliver either in an emergency department, which is a safe for most people but not an ideal location for delivering your baby, or have to find some way of getting to the other hospital, which is over half an hour away by car. And I just found that to be an example. This was a nonprofit health system. This is a system that is supposed to be able to provide at least the minimum services to its community, and because of the financial pressures weighing on everyone, not just the for-profit system, that community ended up missing that resource. And I'm still worried about the people in that community and how it's going to play out over the next few years.
So have you heard of any other communities that have experienced the same issue?
I have, actually.
Yeah,
So
okay.
I'm a member of the American College of Emergency Physicians, which is a nationwide organization, and it's our specialty organization, and this has been a concern across the country, and most especially in rural areas where we already have workforce issues in terms of staffing emergency departments and hospitals at large. That's compounded by some of the laws that have passed in recent years in some states that have limited access to reproductive health and made a lot of OB-GYNs leave certain states. So there's just a workplace shortage on top of the financial limitations that affected the community I was talking about.
Okay. Is there any efforts that to help like reverse that? Is there any ongoing efforts beside you sharing the story right now?
Yeah, I really appreciate the opportunity to share my story. There are efforts. The ones I'm most familiar with are through my specialist society, ASAP, largely through the lens of the Rural Transformation Funds, because many of these communities are rural. There's a real interest in using rural transformation funds to ensure not just emergency care, but OB-GYN care in these communities that are now at risk of being under-resourced when we already have a maternal morbidity and mortality problem in this country. I believe that ACOG, which is the American College of Obstetrics and Gynecologists, also have some efforts underway to ensure coverage for rural communities for OB-GYN, although I'm less familiar with those efforts.
Okay. So can you talk to me a little about your own background? Why did you choose emergency medicine?
So I'm actually a second career person. I used to work in IT, and I didn't really thrive sitting at a desk, and ultimately I thought through all the things I liked and decided to go into medicine. I ended up having 4 children before I made that decision. I had 2 more in medical school, so family and community are very important to me. And I chose emergency medicine because I spent so much time learning medicine. I didn't want to specialize in just one part of it. I wanted to be able to use all of the information I had learned in medical school and be there for people on the hardest day of their lives and provide, if not cure, then comfort whenever possible.
How was it balancing going to medical school and having a family?
It was challenging in a lot of ways, but in some ways it actually gave me some balance, because a lot of my friends who were younger and in school with me at the same time, sort of the next test was the most important thing in their lives, and I was dealing with my kids having some flu virus or something, and so I had a little bit more of a, I don't know, perspective maybe. I had a lot of family support, which made it possible.
So if there is one thing that you have learned in your journey that now guides your well-being and also your decisions, what would that be?
I think that community and people taking care of people is at the heart of medicine, at the heart of community. We can never be replaced by AI as long as we remember that it's the human touch that heals the most.
Right. So do you engage in any art activities, any creative or art activities?
I do actually. I just hosted a summer camp for adults last week. I'm not good at any artistic activities, but we painted kindness rocks and tie-dyed some t-shirts and played in the creek and just tried to get outside and touch grass and remember that it's not all that serious. This is our one wildlife and we get to enjoy it.